What's your go-to in terms of number of screws distally? I mean, are you one, two,
Yeah, I
static?
Yep.
What's
I'll typically follow nail design patterns. If I use a short nail, then I'll do a single screw, which often falls in the dynamic hole, which is just based on company design. If I do an intermediate nail, it's almost takes no time to add an additional screw, and I think you have a really good tight fit here. But anything that's a little looser, you really avoid the windshield wipering with a circular static screw versus a more oblong cylindrical hole. So I will typically do two screws if there's any sort of space left in the canal. And if I do a long nail, I'll often do two screws because I'm sure you've seen this, in a long cephalomedullary nail, sometimes you really have a hard time. You don't think about where you're parking the distal tip of the nail, or maybe the femoral anatomy is a little off. And the nail can be, for instance, very far medial or very far lateral, or it's very hard to control the tip of the nail. You really just want to secure the angular reduction proximally, and you think less about where the tip of the nail goes. So, for instance, if there's a nail tip that's very far medial, and you get a very small amount of threads across the nail before it hits the far cortex, I'll add a secondary screw just to help secure the overall stability of the nail. So I'm probably more often than not using in an intertrochanteric fracture that I use a nail two distal cross locks if I go long.